Healthcare centers are at the crux of functional health systems, the first point of contact for healthcare seekers across communities of Nigeria. Primary healthcare do more than providing affordable and accessible healthcare services to disease detection and the improvement of the national health outcomes. In spite of the critical role primary healthcare centers are saddled with, it is surprising that many struggle to meet the needs of the people. How well is Nigeria's primary healthcare system positioned to deliver on its mandate? The progress, the challenges, and the path to a healthier nation. This is our focus on this episode of Health Options. We hope to espouse on as we engage a health system strengthening and financing expert. Also, expect to learn more tips to healthy living from our abundant natural resources on Nature's Corner. I'm your anchor, Salwa Khalil Ibrahim. Welcome. Primary healthcare, or PHC, was designed to bring health services closer to communities. At that level, the battle against preventable diseases begins. For many Nigerians, access is still a challenge. However, government and development partners over the years have made efforts to revitalize Nigeria's primary healthcare system, while increasing the number of available centers to serve the healthcare needs of the people. Are the plans yielding the desired results? Answer to this question will come to you after this timeout. My guest is a health system strengthening, policy and financing specialist, Dr. Aisha Aminu Sanchi. It's good to see you, and many thanks for joining us on Health Options, Doctor.
Thank you very much for having me, Salwa.
Yeah, to begin with, how will you describe our current healthcare system, especially the first point of healthcare delivery, that is our primary healthcare system?
Well, I can say that the system is working because we have the enabling environment, we have the enabling laws and policies, and we have the structures, we have the manpower. However, I can tell you that the health system in Nigeria is facing a lot of challenges, cutting across the inadequate infrastructure, lack of adequate funding, inefficient expenditure on health, inadequate skilled personnel, inefficient healthcare financing that has to do with low budgetary allocation and also low releases, lack of resource optimization. The money is not there, but the little that is being allocated to the healthcare sector is also not utilized efficiently. So these are some of the issues, and also lack of non-implementations of key health sector reforms is really a setback on the quality, on the impact we are supposed to feel as Nigerians of the quality healthcare delivery, especially at grassroots level, that is the primary healthcare centers.
Okay. Let's get into reality check. We all visit hospitals, and in communities especially, there are primary healthcare centers. Expectedly, there should be. Let's put it so. Now, in a situation where we have these facilities, the structures are there, But then when you look at it, there are no enough manpower and then the equipment in manning these systems. Those are some of the challenges which I know you mentioned earlier. Now, what will you say, you know, is the real issue?
If we look at since independence, Nigeria have implemented or established key health sector reforms which either are not well implemented or partially implemented or not implemented at all. So to achieve some of what our expectation, the health outcome expectation at the primary health care centers, we need skilled manpower. We also require adequate financing. Like when you look at all the reforms that have been implemented by the Nigerian government, is partially implemented. If you look at Basic Healthcare Provision Fund alone, it's a very good initiative of the federal government aimed at supporting the vulnerable population in the country. It is 1% consolidated revenue that is supposed to go directly to the facilities in form of the direct facility funding through the 2 gateways. And one of the gateways is the primary health care center. And the whole aim of that gateway is to revitalize these facilities so that they can be fit to provide quality health care service delivery for our citizens. But however, the federal government has done its own obligatory part by releasing this 1% in 2018 when the Basic Healthcare Provision Fund had its full implementation. But with state governments yet to do their own obligatory part. What are we saying? There's supposed to be a counterpart funding from each state. There's supposed to be some statutory allocations as enshrined in most of the laws that were establishing those initiatives. So by the time we have this money going pulled together from the State Primary Healthcare Development Agency and going down to facilities from that gateway, and also capitation that is being paid from the state health insurance agencies or from the National Health Insurance Authority down to the state health insurance agencies, then down to the facilities. These funds will support in revitalization of these primary health care centers, because on one hand, that fund stipulates a certain percentage for the engagement of adequate manpower. Like if they have manpower gap, they can use part of the money to bridge that gap. It can also be used to buy drugs, and it can also be used through the other gateway to improve service coverage and to allow citizens to have access to quality health care delivery. But however, these things are not, like I mentioned earlier, well implemented. But I can also say I appreciate the present Minister of Health, because, you know, when he came on board, yes, he did a lot, and, you know, he reviewed so many health sector policies, and he said, yes, health is not a Ministry of Health Affairs alone. It requires a whole society approach, because certain diseases that are really killing our people are preventable. Sometimes it's not even about non-existence of these facilities or lack of manpower, but access. Maybe the access road is not good, or maybe there is no transportation and a woman is in labor. So it is really doing a lot through a lot of initiatives like the SWAP. And one thing he did was when he came on board, he said he want to crash down maternal mortality.
We go to the challenges, if you may allow me. Now, you mentioned the SWAP, that is the sector-wide approach, and recently we've seen a lot of effort in terms of counterpart funding, because like we always see, you know, in every circumstance, the government cannot do it alone. Now, what will you say, or how can the state government, should we be holding them responsible? Are they doing enough in terms of meeting their own obligations? I
can tell you that they are not doing enough. I'm sorry, especially in the northern part of the country, where we have the highest burden of maternal and child mortality. And then when you look at this reform that the National Health Act that brought about the Basic Healthcare Provision Fund, it's not just the mandate of the federal government, but federal government has fulfilled its own part of giving that 1% consolidated revenues. Only that 1% coming from the federal government that the state is still utilizing. So, and how many vulnerables do we have? The total amount received from the federal government can only cater for less than maybe 2% of the total vulnerables that we are having in the state. So I can say it's not adequate. It's one thing to have these facilities. It's another thing to have the drugs that you are procuring. It's also another thing to have the manpower. 500 naira can deny access to that quality service care for an average village woman that needs to go to the facility and deliver. So government should really look in depth and see how to operationalize these important reforms. Assuming the government should give its own counterpart, we may extend the number from 170 maybe to 300 or 400 facilities being revitalized. Okay. And again, federal government recently, there are a lot of initiatives, like I said, by this current administration through the efforts of the current minister, which is putting in place, but the states need to emulate.
What state, in your own assessment, will you see are doing well in terms of, you know, these policies?
In the northern state, I can tell for Nasarawa and Katsina state, with Kano state is also doing well, but that is that.
Okay. So now let's take a break here. We'll take off from here when we return shortly. Please stay with us.
Kuka, that's the name in Hausa.
That is call it Oshe.
In Yoruba.
Oshe, Igi Oshe.
Okay, so I know it's Kuka.
I am delighted to have you join us on Health Options, the program that not only tracks government policies on health.
The total cholesterol is made up of some components. The high density lipoprotein, which is the good cholesterol, the low density hypoprotein, which is the bad.
Cervical cancer, a type of cancer that develops in a woman's cervix.
There were opportunities for women to get screened for both cervical and breast cancer, maybe up to 30,000, but we'll be having figures of 5,000.
If you just join us, the program is Health Options and the NTA, and today our focus is on strengthening our primary health care system with my guest, Dr. Aisha Aminu Sanchi. Many thanks for being there, Doctor.
Thank you once again, Salwa.
Now, what strategies can government, adopt to improve access to quality healthcare services, particularly in primary healthcare facilities, to enhance healthcare outcomes and strengthen the overall healthcare system?
The system is there, and then the policies are there, and basically the challenge we are having is in some places where we have the services, access to those quality services is an issue where one needs to spend out of pocket for him to access. So to address those issues, government have to rapidly implement some of these objectives identified. What I want is every pregnant woman should have access to quality service delivery, not just in the identify 117. And to achieve that, we need the state governments to implement. They have a Nigerian Governors Forum. I would appreciate if the coordinating minister will talk to them, like have a dashboard where every governor will see where his state is, how it is performing, number of maternal mortality that is being recorded in each state per day, and let them also align it with what they can do to address that. Some of which is, I mentioned earlier, implementation of the basic healthcare provision fund.
No.
So we need improvement in budgetary releases. At the ministry level, the issue of fragmented coordination, we need to strengthen coordination at that level. We also need to optimize our resources. But is more important and what will bring about quality healthcare service for citizenry. And also the issue of the manpower, we need to bridge that gap. We've seen it by engaging the private sector. They can do a lot.
Okay, I was coming to that public-private partnership. You know, could that be another good option?
Private sector are important players in the health sector because they can invest, they can support in the provision of enhanced medical services by deployment of modern equipment to facilities. They can adopt these facilities. We've seen it where private sector engagement gave birth to adoption of facilities. They can pick a hospital, revitalize it, give it all the necessary things they need, and then with certain incentivize some of the activities so that we have the expected outcome we expected from those facilities. And they also, there are situations whereby they support the state in recruitment of skilled personnel so as to enhance services. They also supply medical equipment, standardized medical equipment, and also introduce a modern way of diagnostics to our facilities. Okay. So I think they are key and critical players in the health sector that we need to leverage on their existence to have more money in the health sector.
Okay, it's all about funding. Now, what are some innovative or digital solutions being adopted to improve health data management and service delivery at the primary health care level?
Currently, we have the electronic medical record using mobile phones, using tablets, whereby we tease out all our records and at a glance, you'll be able to know that where we are and what we need to do. Because there are softwares that I build that come with indicators and everything that you see them in graphical representation telling you what. So those are the ones that we are currently using at the primary healthcare centers.
Okay. Now, can you share effective strategies and lessons learned from implementing health reforms at various levels, now highlighting approaches that drove successes and challenges, you know, over the years?
Yes, I can tell you that I will align some of the lessons I've learned with what the current minister is doing, like the whole society approach. We believe everybody is important. Yes. And this cross-sectional engagement, we believe that it is not just Ministry of Health. Occasionally, we invite the Ministry of Agriculture. We sit down at a round table. We discuss some of the sicknesses that we have, metamorphosis from the food we eat. So how do we see that in the line of production of what we eat, that we follow the ideal and best agricultural practice so that we end up eating what is ideal for our health? Okay.
In the nearest future, now, where do you see our primary health care system, considering the commitment by the government? What should the people be expecting?
I can say that universal health coverage is in sight with more commitment by the federal government, which I believe very soon the state government will also key, and the local governments. And once they key into the existing reform, they will be able to address some of our key challenges. And so soon, we will be seeing so many facilities revitalized in our communities. We see increase in the number of skilled health personnel. We also see increase in the number of drug supplies to the facilities, and also private sector engagement will give birth to enhanced service delivery through supply of drugs and consumables. Okay. And finally, the implementing partners will invest heavily in the system.
Okay, so that is looking forward to where our women and children can access these facilities at no cost and get the best of care. Many thanks, Dr. Aisha Sanchi, for coming on Health Options.
Thank you very much, Salwa.
Next is Nature's Corner.
Welcome to Nature's Corner. Today we are going to talk about organic infusion. Organic infusion is a kind of tea that is specifically made for, is individualized. According to our body chemistry, that means we need a marker that will identify what is beneficial, harmful, and neutral to your blood type. So we now take what is centrally good to all the blood types to produce a kind of tea that people will not react to. So the whole essence of it is our health is what we take in. So, and food is medicine, though it is a paradox too, because food can be poisonous as well, because if you take the wrong one, the one that will counteract against your system, you are bound to face certain ailments. So what we are trying to advise that you go around taking any kind of type of tea. You don't know whether there's something there that may go against your body chemistry. What we are saying now, why can't you gravitate towards the tea that is your own type? Your own type of tea that will now go, and probably also what health target do you want to achieve. Now in the age of IT, ignorance is a choice. You can Google or make your own research and find what bioactive compounds you want to take in and for what health targets you want to achieve. Thank God, there's a groundbreaking research now that we actually react to food and herbs and tea according to our blood type. And I think that research has been made by one Peter D. Adamo, which tabulates foods according to different three categories into beneficial, harmful, and neutral. So he categorized the beneficial as medicine, which will help you boost your immune system and probably cure you of diseases. While the neutral ones give you basic energy to go about your daily business. But then the harmful one counteracts against your system. It acts like poison, which may harm you. That's why we are saying, why should you just go for a meeting or for any joint and you take any type of tea? What we do at My Brew is we now take, once we know your blood type, we know what health target you want to achieve, we now curate your tea according to that specific target. Don't you take guava tea for goodness sake? Guava leaves tea? Mommy must have been preparing something like that for you at home. Uncle must have brought some exotic herbs from the bush, and they brew it for you at home and take. In Africa, we have more tea than you can get in the whole wide world. And it is part of our culture to be taking tea. It's just that probably we have not been calling it tea. We are waiting for the white man to come and call it tea before we make it. So what I want to do, I want to sensitize people. Instead of taking tea that they have put on the shelf, which has a long life, those things have preservatives. Okay. So we have tea that can balance hormones, balancing of hormones. We have tea that's good for diabetic patients. We have tea that's good for those with high blood pressure. We also have tea for people that are obese. And we have tea people that will have coronary infections. And more. God has blessed us with a lot of greens. So what we are saying, go green and let it be your cup of tea. Tea is easy to make. All you need to make tea is hot water. And you infuse those organic things into it and you now take.
We have come to the end of this week's episode of the program. Here is a reminder before we go. The health of a nation begins in its communities, and strengthening primary health care is not just a policy choice, it is a lifeline. The expectation of every citizen is a better infrastructure, motivated health care workers, and an active community involvement. For Nigeria's journey to universal healthcare coverage depends on a PHC system that works for everyone, everywhere. You can watch these and previous episodes of the program on YouTube at NTA Networks. where you can also share your comments, questions, and suggestions. Thank you for watching. I am Salwa Khalil Ibrahim.